All right, good afternoon, everybody. Daily update here with Paul Mounds via the virtual world, Josh Jabal, Amy Porter with us, a Commissioner of Aging and Disability, because we are going to be focused on vulnerable populations today. And Dr. Coe is here on behalf of the Reopening Committee to take any questions you've got as Reopening Committee starts to wrap up its work aiming towards our May 20 date. Very quickly, I'll just show you on our daily summary. You could say the positive cases are up, but I'm a glass half full type of person. What that means is, as a percentage of the tests performed, it's down, and slightly under 10%, which is, again, a very important metric. And I'm very pleased that the number of tests you see are ramping up, 6,600. Tragically, another 94 fatalities, and that's up as well a little bit over the last few days. And current hospitalizations is now in its third week of a downward progression, which is such an important metric for us. Let's just jump ahead now to what we need to do to protect the most vulnerable of our populations. That's important, as we've said before, because it's the right thing to do. You know, African Americans much more likely to be infected, much more likely to suffer real complications. And it's also important to do when you look at the fact that it's in certain areas that you have the most risk of a flare-up. Look at the congregate housing here, for example. Who do we need to protect? The congregate housing. You know, that's assisted living. That's prisons. That's nursing homes. These are the groups that are really important that we keep them protected, which is part of what our testing protocol is going to be and why we focus on that. Frontline workers. You know, look at the nurses, the first responders, our officials, public safety. They're the folks interfacing every day, often with these vulnerable populations. These are folks who we're going to take a special effort to protect. Racial and ethnic minorities, as I suggested before, particularly vulnerable, because they have some pre-existing conditions, but also densely populated communities, those that live in areas where it's not easy to socially distance, where you have more people in a home. Those are the populations we're really going to focus on when it comes to testing, when it comes to the support groups. And finally, that group that is high risk due to age. Unfortunately, I am in that category. And people over the age of 60, 65, they should be staying at home. Even as we slowly think about reopening parts of our economy, they should be staying close to home. And those, again, that have some of the pre-existing conditions, especially that which impacts the lungs, say asthma, those are the things that give you the greatest risk, and those are the people we need to protect. So our priorities when it comes to testing is vastly ramping up our testing, mass testing in those most vulnerable populations, focusing on them both in terms of symptomatic, those who have the symptoms of COVID, flu-like symptoms, and also those who are asymptomatic. So we can make an extra effort to make sure that those populations are safe. That's how we reach the vulnerable. And then Amy will help us describe how we support the vulnerable once we find out what that status is. So testing, how do we ramp up our testing? As you know, over the last few days, we've described some of the partnerships we have, Yale, New Haven, Jackson recently here, Genesis Diagnostics, Hartford Healthcare, Quest. These are all groups that are going to allow us to ramp up our testing. We said we'd be doing 42,000 tests a week starting next week, and Josh is highly confident we're going to blow through that number. And I think it's really important and ramp up towards 100,000 and beyond in June. I can't overemphasize how important testing is, but testing only works if you're willing to get tested. And right now, as you know, we have a lot of capacity at our hospitals, a lot of capacity still at our drive-through facility in New Haven. You probably heard we're going to be rolling out additional testing facilities in our partnership with CVS. I think another 12 pharmacies be up and operating very soon to make testing more easily available for each and every one of you. We're rolling out on our community health centers so that the most vulnerable populations in those tougher neighborhoods can know they can get tested safely, they can get tested without cost, and no cost for treatment. And Finally, we're working closely with our churches as well as the community centers. Senator McCrory has helped us there as well as we try and get the message out how it's important that you go out and do that testing, and the pharmacies allow us to take the test to you. So when it comes to our priority, when it's mass testing, here we are at the Phillips Health Center in Hartford's North End. This is the program that Doug McCrory helped us put together. They already have 300 people who have been tested to date, and we're ramping that up, and it's really important. How do we reach the vulnerable? How do we reach out to them? You know, there we're working, as I said before, with some of our fellow stakeholders, starting with the churches. Multilingual, you're going on radio and other broadcast media, Spanish, English. Go where people are and tell them what this means to you and your family and what it means to your greater community. We'll be supplementing that with more public service advertising. And there you see our contact tracing, which I think we have a chance to talk about in a minute. Support for the vulnerable. You know, here Amy's team is helping to take the lead, because if you're tested and you're found to be COVID infected, you're test positive, what do we do for you? Does it mean you just, by yourself and self-quarantine? No. If you're in a crowded situation, we provide you housing support at one of the local hotels in particular. We provide food support for you. We've really ramped that up, courtesy of Brian Hurlbut, our Commissioner of Agriculture. We're able to deliver, Amy says, I think it's hundreds of meals now a day here just in the greater Hartford area to those who are in the hotel or those who are self-quarantined for one reason or another. The medical support is so key as well. And I think there you're going to find that we're ramping that up, and I'll get to that in a second. And finally, the COVID care kit we'll talk about. Next slide, please. A lot of talk about our reopening metrics, and where do we stand on that? And I was accusing Josh of a little bit of grade inflation today, but he's explained to me that I think we're doing pretty well in these metrics. Obviously, we're way beyond a 14-day decline in hospitalizations. I think you're seeing that we're going to not only test 42,000 and beyond next week. I think on the contact tracing, there's a question about what is sufficient, but Dr. Koh was saying a contact tracer can maybe take on 10 or 12 new clients a day. And given that number, we have over 300 volunteers right now working through our local health departments. That would mean we could handle, starting right now, say 3,000 folks who are tested positive on a daily basis. That's one definition of sufficient. I think we described a little bit what we're doing for the vulnerable populations, and we can always do more. Healthcare capacity and PPE, we've talked a lot about why we think we're in strong position there. Finally, so far, appropriate physical distancing regulation, I think we've been strong on, and I've been really proud of the people of Connecticut to follow that. But I also worry, because this is a place where you can fall backwards. This is a place where you look around the country, you see it's not just in a nursing home, it's not just in a prison where you have a flare-up. You see Tokyo, no, it was South Korea, Seoul I think it was, where one super spreader went to several nightclubs and infected many, many people. I saw that in Wisconsin yesterday or the day before, the Supreme Court lifted the stay-at-home regulations and, hundreds piled into the bars. So appropriate physical distancing regulations, that's one I watch like a hawk going forward. With that, I'd just really like to ask Amy Porter to say a few things about where we are on these vulnerable populations, and then we're all here to take your questions. Dr. Koh is here and Paul Mounds as well. Amy?
Thank you, Governor. And thank you for having me here today. Protecting our at-risk populations is something that is a significant priority for the administration. We've been working across state agencies, across the administration. We've been working with state and local health partners. We've been working with community organizations to address the needs of specific populations. I have been fortunate to work on the Reopen Community Committee, and it is an incredible group of people. It is chaired by Dr. Marcella Nunez-Smith, who's the Director of Equity Research and Innovation at the Yale School of Medicine. We also have members, a pretty diverse set of members. Marie Allen is the Executive Director of the Southwestern Connecticut Area Agency on Aging and Independent Living. Dr. Ken Aline is the Vice Chair of the Connecticut Health Foundation. Nora Duncan, the State Director of Connecticut AARP. Rochelle Palash is the Assistant District Leader for an SEIU local. Daria Smith, the Executive Director of the Connecticut State Independent Living Council. Mike Frieda from the Connecticut Conference of Municipalities, and then we're also joined by three of our fellow commissioners, Commissioner Gifford, Commissioner Sheff, and Commissioner Delphin-Rittman. This group of individuals has spent an enormous amount of time trying to identify the needs, trying to listen to the voices in the community, and they all bring their own extensive networks of folks. When the governor talks about outreach and having people go out and speak to the communities, these are all individuals with their own incredible networks, and they're all incredibly committed to going out and having these conversations, figuring out the key messages so that as we ramp up the contact tracing, as we think about more people in quarantine and isolation who might need supports, we can encourage people to do that knowing that we're going to have the system in place. If somebody needs access to housing, as the governor said, if they need access to food, if they're trying to figure out, I have symptoms, but I'm not sure if they're significant enough, and I don't have a doctor. I don't have a place to go. So making sure that people are connected with active clinical monitoring and really the tools that they need through a care kit, like a thermometer, a pulse oximeter, masks, emergency information, educational materials about what to do as symptoms progress. So that's all the pieces that we're ramping up to make sure that folks that are in quarantine and isolation are supported as we move forward.
Well, thank you, Amy. Any questions, Max?
The Connecticut Mirror.
Good afternoon. Governor, you are, I assume, in receipt of a letter from 11 Democratic state senators, which I won't go into all the letter because it is chock full of questions. But first question, do you have a general response to their concern, which is quite simply that they have doubts that the state is ready, that they don't have confidence that the metrics for how to judge when it's safe to reopen and remain open have been defined. They also have questions about the availability of testing and contact tracing. So could you please give a response to that?
I think they should listen to our briefings here. I think Dr. Coe and his team helped put together a set of metrics. I believe the Senate Democrats thought the metrics were really appropriate. Then we've tried to do on at least a weekly basis, as we did today, to show you where we stand on each of those metrics. Maybe they wanted more testing, but we've far exceeded what we planned to do. And maybe they want more contact tracing, but we tried to say we have more than enough to handle everybody we find to be infected now. Can we always do more? Yeah, I appreciate the ongoing concern that people have. But I think we've got the right balance going forward right now. I think you have a sense that we put public health and public safety first and foremost. And whatever we do, we're doing very cautiously.
At least two of those people on that letter were people who have participated in your briefings, and they're generally complimentary of the advisory group, even as they raise these questions. But to what extent does this? Let me ask another question. When it comes to contact tracing, Joe Brennan, the CBIA president, on the Business Roundtable call earlier today, he offered another concern about contact tracing. And his concern was once Connecticut reopens businesses, that it'll be very important if there is any outbreaks to be able to accurately and quickly trace the source Otherwise, the fear is that you will have to close businesses again, which his view would be that would be disastrous. So can you address the question of how important it will be for contact tracing to be done to make sure that there's a confidence that businesses are safe places for people to come in as consumers and to be there as workers?
Yeah, I think nobody takes that more seriously than the businesses themselves. I think they know that if their restaurant or their barber shop, we found that there was an infection there, what that would mean in terms of business, what that would mean in terms of their employees, what that would mean towards the entire perception. So we've got very strict protocols for each and every one of these facilities. Most of them paths are by appointment only, so we'll know exactly who is in and out of those facilities. And I've heard from some of the folks in the legislature, maybe you're going too fast. I heard from 130 restaurants yesterday, you're going too slow. We're trying to get a balance going forward to keep you safe first and foremost and convince you that on all these key metrics, which we described at the beginning of this session, we're taking your health first and foremost.
And the last thing is that one of the questions was about looking at your approach to statewide standards as opposed to Governor Cuomo, who's now talking about differentiating reopening based on county. What's your latest thinking on that? Do you still see Connecticut as just too small to go on a county by county basis, or are you open to perhaps some differentiation by county?
At this point, I just think we're too small. I mean, to go to Lake Erie is a 6-hour drive, but if you're in New Haven, you can get to any part of this state in an hour or so. We're a relatively small state, so the idea that you would open up a restaurant here or not there, or a hair salon here but not there, I think the possibility is promoting a lot of traffic back and forth. But, frankly, we can always take a second look at that as we see what transpires going forward. But that's my strong inclination so far. And frankly, it was a strong inclination of the Reopen Connecticut Committee, who I listened to.
Thank you.
Channel 3 Eyewitness News.
Hello, how's everybody today? My question is, I did sit on the roundtable today, and it's clear that the Department of Economic Development and everyone, all the partners on the committee have been working to put this plan together. But a lot of businesses, restaurants and hair salons, many may decide not to reopen next week because they just can't institute and implement all of the things. What kind of message do you think that will send to people that it's still not safe or it's going to get better?
I think it would send the opposite message, that these restaurants or salons are very thoughtful. They're only going to open when they're absolutely ready. And if they want to take an extra week or two, I think that's totally appropriate. And I think we've seen that around the country.
And my other question is, it's more on the lines, kind of what Mark had said, the confidence level. After reading some of these guidelines, and albeit safe, smart, practical, people going to restaurants with masks on and having to wear them at tables, that's difficult, isn't it?
Well, that's one reason we didn't like indoor dining, and we thought outdoor dining was an awful lot safer. And if you're implying if they wear a mask, will that make people more anxious about going there? I think just the opposite. It would say to me that this is a facility that takes the protocols very seriously. Dr. Coe, do you want to add anything to that question?
Yeah, I think what we know and what we've known from outbreaks throughout the world, but also here in the United States, is that it's really being indoors in confined spaces, which is problematic and has the higher risk. When you're outside, you have hundreds of liters of air exchange coming through. The risk is really quite mitigated. And so that was, I think, behind the Reopen Connecticut Advisory Board, but also the state's recommendations to, have outdoor activities, just as we're doing with biking and hiking, but also outdoor activities, whether it's outdoor restaurants. This is kind of the same logic. And I think also the other issue. And just to reinforce what the governor had said is that in the criteria, the guiding principles for reopening for phase one, choice is an important one. So those restaurants, those businesses that are not feel that they can, go on these guidelines, which are actually quite well developed by our
happen.
He was making an excellent point, but maybe we should keep going for a second. Max?
We will get back to Dr. Coe.
Thank you.
For now, we will move along next to NBC Connecticut.
Good afternoon. Sticking with the restaurant question, this afternoon during the roundtable, or this morning I should say, the Connecticut Restaurant Association brought up the point that there are a lot of restaurants that are being left out of this May 20th opening just by the fact that they may not have a patio. They're urging the state to allow limited indoor seating and dining beginning June 3rd. Do you think that's feasible? And if not, when can we expect that to start to happen?
My instinct is that it's early, and I want to see a little more experience with the outside dining first. I've been impressed, though. I mean, Sarah Bronin here in Hartford, Freddie Camillo down in Greenwich. People are thinking really creatively about how to close down some roads to traffic, open up more for pedestrian traffic, more room for outdoor seating. I think it could be very interesting over the course of the next month, and we'll learn a lot.
And secondly, now that we're getting some nicer weather, a lot of parents want to know, when will the local playground be open? Will the pools open this summer? Where does that fall in your phases, and will you be leaving that decision ultimately up to the municipalities?
Right now, that's a decision that's left up to the municipalities. They control their local parks and the access there. But my instinct is that could be, since it's outside, we can do it carefully. If they have people there that can clean off the swing set, we could do that perhaps in the next round. But maybe Paul or Dr. Coe would have an insight there. Paul's on mute.
I am on mute. No, what you said right there, Governor, is right on line. That local decision, local pool, local park is a decision for the local municipalities. We have set standards through the Department of Energy and Environmental Protection for our parks and for our beaches. And we also hope that municipalities would follow the lead that Katie Dykes and her team through the Reopen Committee as well have put forward. That's also serving as a guide for our regional partners as well.
Thank you.
And Dr. Coe has rejoined us. Dr. Coe, the question was the possibility of playgrounds and local parks reopening at some point and what might be required in order for that to happen. Unmute.
I think there was a previous question about the safety of activities, whether social or business outdoors. And outdoors is certainly much safer than indoors in confined spaces. And in terms of making playgrounds and in our parks safe, I think the concern is to maintain social distancing, the use of face masks that prevents transmission from person to person. And I think the third point, which is important in keeping our parks and our playground safe, is disinfection. We know that we have in our respiratory secretions in our saliva virus that potentially can infect other people. The practice is to keep those, disinfected frequently, especially those that are being touched, such as in bathrooms in our parks, or whether they're swings or slides, the constant disinfection. These are all in the guidelines that are being actually being reviewed and formulated from our occupational review group.
Move along next to the Day of New London.
Hello, Governor. I wanted to ask you about another letter you may have received. This is from the Southeastern Connecticut contingent. It was dated yesterday. And they're asking for you to address the situation in Eastern Connecticut, where the unemployment claims are spiking, largely because of the unemployment coming from the casinos. As you know, Fox was changed the status of their workforce from furloughed to laid off, or will be as of May 31. No more health benefits. So I'm wondering what your response is to that letter, and in which they also ask again that by executive order you authorize online gaming and sports betting as a way for the tribes to generate some revenue. And maybe as a secondary question, I'm just wondering, what is the status of your talks with the tribes, and are you involved in those personally, and how often are they taking place?
Yes, I have had conversations with the tribal leaders. I'm trying to find ways to move this forward that does not result in endless litigation, and we can move this forward. The tribes have been amazing partners for this state for a long time. I feel desperately for the folks that were furloughed and then laid off. Thankfully, we have a good workman's unemployment compensation system. It's on time, getting the payments out now with a true-up from the federal government. So I think that's something that carries people forward for a while until we can get the casinos open safely.
And there's no possibility of an executive order or any action in that way? Have you sort of addressed that issue already?
An executive order to
authorize online gaming, sports betting?
No, I think that's going to take a little more discussion right now. There are a lot of players involved in that who have strong feelings, and I would like to see this get done in a way that saves us from endless litigation. We haven't gotten it done for the last 5 years, but I think you're right. Now is a good time to have that conversation.
Thank you.
Fox 61.
Hi, Governor Lamont. This is Taylor DiCello. I'd also like to respond to the comment that you just said that we have a good unemployment system that's on time and getting payments out now. Well, since the beginning of April, I've been working with Nancy Steffens at the Department of Labor to answer people's common questions. This evolved to where I'm now personally sending the Department of Labor specific claims. I answer nearly 200 emails a day from claimants who say they cannot get a hold of the Department of Labor. Many of them respond saying I'm the first person they've heard from in nearly 2 months in regards to their unemployment claim. I was just on the Department of Labor call, and they say they're hiring dozens of people to help answer general questions. But this does not help people today who haven't seen any income for 2 months. So, Governor, what are you personally going to do to expedite this process and ensure the people of Connecticut that when they pick up the phone to call the Department of Labor, someone else is going to pick up on the other side and help them?
Yeah, no, that's a fair question. Unemployment claims, as we said before, spiked up dramatically. Our old Cobalt system, the number of people there had a hard time keeping up. Thanks to a lot of amazing work over there, we've answered, I think, well over 95% of those claims. Well over 450,000 payments have come out. The $600 true-up has come. They had some catching up to do. You're absolutely right about the self-employed, but I think we've had tens of thousands of those payments have been made. I'd like to think we're very close on that. There are, though, still many where maybe there was an error or a problem in terms of the original submission. Those have been slowed up. Those generate an awful lot of telephone traffic. Obviously, online results are a lot faster. But I can tell you that the commissioner there is doing everything he can to get additional people there to answer phones, because in this time of crisis, tomorrow is not soon enough.
Maybe you're not aware of the situation fully, but we have people who call the Department of Labor and are on the phone for 6 hours, and then the Department of Labor phone lines close and their call is never answered. So why does it take us pushing you to get people hired at the Department of Labor in order to answer general questions people have? I mean, I'm having trouble answering these people's emails. I'm looking at an email right now from Emily. She's a single mother of a 5-year-old. She hasn't had any money in 2 months. So what do you suggest I say to her? Just wait it out another week?
Well, first of all, I didn't need you pushing me. This is front and center in terms of all of our priorities. We faced it head on a couple of months ago when this started ramping up big time. I've looked at all the other states that are in similar or worse situations, but no excuses. If Emily or others, need that extra support, maybe just send us those names. We can try and respond as best we can on an individual basis. But even more importantly, know that Every day, I believe the good people over at Department of Labor have ramped this up in a significant way, got almost all of the claims that were properly processed out the door right now, and I think we're catching up big time. Telephones are just a mess. They're a mess in cable TV where I came from, because when there's an outage, everybody calls at the same time. And that's no excuse. We've got to do better there as well, get additional people who can at least give people the answers to the questions they need. I take your message loud and clear.
Next to the Associated Press.
Good afternoon, everyone. Governor, I was hoping to follow up on Brian Hallenbeck's question regarding the letter from the Southeast delegation. Is there any alternative to gaming, online gaming or something like that they're asking for to help this region? Because I can't think of another part of the state where such a huge employer is shut down. You've got thousands of people out of work. You've got the city of Norwich that has a public utility that lost about, over 20-something% revenue because they're not getting the casinos. Mohegan was buying water from them. You've got laundry company that's no longer buying electricity and water. I mean, it's a huge economic hit. Is there anything that is in the works to maybe help this part of the state?
Well, I really care about the people. I care about getting those people back to work safely. I do worry a lot about the nature of a big gathering place like a casino is that does bring in people from all over the region and maybe all over the Northeast region. Seems to have a big, a number of elderly that are attracted to something like this. So I've got to work very carefully with the tribes to make sure what we do when is done in the most thoughtful way possible, because it can be a place that's a source of high risk if we don't take it appropriately.
And are there any other options? Oh, go ahead. I'm sorry.
Yeah, no, and I would just also add that the governor has been in constant conversation with the tribal leaders. We'll continue those conversations tomorrow. Myself and Commissioner David Lehman will be part of those discussions as well. And we're also having discussions with our regional partners, understanding what is happening in terms of casinos in our region. In terms of your more specific question, Sue, in terms of anything else that we're doing, you basically have spoke directly at the core. The core is that these two entities play a large factor into that region, and that's why we're having explicit and direct and constant conversations with them, but also understanding the overall public health aspect of casinos and the way that they play a role as not only cultural, but also tourist attractions in our region.
But I'm just wondering, is there any kind of thought about a bailout plan or something? I mean, I'm familiar with Norwich because I live here, but there's, over 164 vendors in Norwich alone and a lot of them are out of business right now. And like I said, the city itself relies on revenue from the public utility, and that's not coming in as much.
First of all, we still have $100 billion in the PPP loans from the federal government. So, Sue, I'm going to take that message to David and see if we can target those companies, or maybe we can get them some immediate assistance now.
Okay, thank you.
News 12 Connecticut.
Hi, Governor. So when you talk about contact tracing, are we talking about asking restaurants and businesses, stores to, collect detailed information about customers? I mean, I know some states are thinking about that. There are some privacy concerns, but I mean, aren't you really going to have to do that to figure out, where an outbreak started?
Want to try that?
Yeah, no, regardless of where when someone tests positive and they go into the contact tracing system, regardless of where they've been, whether they've been in a business, whether they haven't, they're interviewed and they if they opt in and they're willing to participate, which we expect based on experience, most people will. That most people want to help, most people want to protect their friends and their family and help protect their health. We'll follow those leads wherever they will be. But again, it is voluntary at this point, but we are optimistic. I think the people of Connecticut have shown that they want to play an active role in doing the right thing to help reduce the spread of COVID, and participating in the contact tracing efforts are a very important part of that.
But I mean, obviously you can, the person who contracts COVID can tell you, where I've been and so forth. But how do you figure out who all the other people that were at that restaurant that day are?
First of all, he tells us who he came into contact with. That's the most important thing we do in the contact tracing. When you get that call, we say, who have you been in contact with over the last 3, 4, 5 days? And and he can or she can say, I'd like to give you that information, or I wouldn't like to give you that information. Most people we think we're already beginning to do this, and as Josh said, that's a way to keep your friends safe.
And Governor, real quick, any update on the dentist and the hygienist after yesterday's meeting?
I think we've got some good news there, Josh.
Yeah, so the group that met yesterday, they're bringing together the synthesis of their thoughts and recommendations. We expect that that's a document that could be finalized as soon as tomorrow. Potentially more review to come, but the sense was from the group that was there, which was equal parts of hygienists as well as dentists, was that there was a lot of common ground around what the right protections are for hygienists for more routine procedures in ways that don't generate aerosols, that ensure that the people working in dentist offices have all the necessary protective equipment. And if they don't, then they won't open. That's going to be a very firm requirement to make sure that employee safety and patient safety comes first. That's true for all of the guidance we're putting out and all of the actions that we're taking in these baby steps for May 20th.
So we're not looking at like a blanket delay?
For dentists specifically?
Yeah, exactly.
Yeah. We assuming that the two groups can come to some common ground, which it sounds like they will, then presumably not. But again, it will be case by case for a certain dentist office. They need to ensure that they have the right protections in place, the right protective equipment, and until they get to that point, then that's not going to be a safe situation.
News 8.
For the governor and Dr. Koh, other states have opened up earlier, and you've been looking at those. You talked about the super spreader over in Korea at the nightclubs. What other kinds of things are you seeing that you like or don't like that the other states are doing? For example, California already has canceled fall semester at their statewide university system.
You want to start with that, Albert?
Sure. And let me just, before getting into that that question, let me just go back to the importance of contact tracing. So I think one thing it's important to understand is that not all contacts are high-risk contacts, and actually we use a rule of within 6 feet face-to-face within 10 to 15 minutes. And so if you can imagine yourself going to a restaurant, you're not having high-risk contacts with everybody in the restaurant, especially when we're having social distancing. So I think that's something important to understand about contact tracing and the nature of contacts and how they cause transmission. Getting back to the original question, which was that about what other states are doing. I think what we've tried to do, and at least for the Reopen Connecticut Advisory Board, is really set the highest bar on safety and public health. And as I mentioned before in previous press conferences, is that our state is at risk. The country is at risk for resurgence. We know because of the transmissibility of this disease. So we have to put in all of the detection systems, such as the ramping up, which is, the governor and Josh has said it, to 42,000, so we can detect an adverse signal, the risk of a resurgence. And we're going to have to keep that going. And that's a critical key pillar of our response. And if you look at other states, that's what they have been doing as well. But we're going to be going beyond. And I think all of the interventions that the governor talked about today about protecting the vulnerable, that's been another key cornerstone of the Reopen Connecticut Advisory Board's recommendations, as well as the state's recommendations. We have to protect the people in nursing homes. We are doing the same, and as many other states. New York, has just announced that they're screening their nursing home workers to protect their nursing home residents. We have started doing this already in Connecticut. We have to keep our correctional facilities safe, both the incarcerated as well as the as well as the correctional staff. We have to go to where the highest risk or the highest burden of the epidemic has hit. And those are our cities, whether Bridgeport, New Haven, Hartford, Waterbury, Danbury. And those are actually behind the rationale of rolling out community-based testing and supports that were talked about today. So if you look and see across the country, we're actually ahead of the curve in terms of really the intensity and the scope of what we've proposed as recommendations from the advisory board, and which are now being implemented by the state.
Governor?
Connecticut Public Media.
Governor.
Sorry. Go ahead, Bob.
I didn't know if the governor saw anything in particular or how he feels about California closing the schools or what he's seen at other states that he likes or doesn't like.
I thought it was too early to make that decision as they did in California. I think we have a model group that came out in terms of the metrics we have as we slowly reopen our, say, colleges. And I think we're going to make a determination on that later based on the facts on the ground and how we've done. I look around the rest of the country, though. I spend a lot of time. I mean, I see, as I said before, the crowds going into the bar in Wisconsin, I think it was. I know Mike DeWine in Ohio, and he's opened up a little bit, and there were some flare-ups, but it was a flare-up in a prison in Marion. So it tends to be those most vulnerable populations where still you see the greatest risk. So we're learning because we're a few weeks behind a lot of other parts of the country in terms of how they're doing things, and we're going to adjust along the way.
Connecticut Public Media.
Ali Wachowski here. As sample sites grow, what outreach is the administration doing to educate people about the importance of testing, besides these daily press briefings that not everyone might see?
Amy, you want to talk about that a little bit, how we're educating people about the importance of testing?
Yeah, thank you. We are working with a lot of community partners. That's a lot of what our community committee has been talking about, making sure we can get the key messages out there, but also making sure that we have the right partners to be able to do that, to go into the communities, to share the messages about how important it is to be tested, how important it is to do that for yourself, but also for those around you. So we're working with our community partners to make sure that those messages get out.
And by community partners, do you mean like churches? Can you give us an example of what community partners are?
Yeah, on our community committee, we have folks from, as I said, from AARP, from our area agencies on aging, but we also have folks that are in communities talking with churches, talking with other nonprofit organizations that are out there. We've been talking with our healthcare partners in the communities to try to make sure we can get those messages out.
Thank you. And
our goal is really to work through the organizations that are established and trusted in those communities, right? So it's friendly faces for folks that know they can come out, receive testing, receive other care if they need it, receive assistance. So we're not really looking to reinvent the wheel, but more get resources out into the communities where they can be most effectively deployed.
And I'll also add, one of the most effective marketing tool for testing is actually having testing in the neighborhoods in which the individuals are actually living and where they congregate, where they call home. And that was the perfect example that the governor spoke in the onset of the press conference of the work with Hartford Healthcare, Senator Doug McQuarrie, and Phillips AME Church that had over 300 people there get tested. That was a community that knew that church, knew that senator, and those are the kind of examples that we're looking to replicate throughout the state.
okay, and for the tests, are most of them being done here, or are they being sent out for the results? Are we to the point where most of the tests are done in states?
Yeah, so in the Early days of the epidemic, most of the tests had to be done out of state at the big commercial labs like Quest and LabCorp. And that was part of the reason that some of the test results were turning around too slowly, frankly, to be able to support contact tracing and some of the rapid interventions that we're designing now. So in the RFP that we've done and the contracts that we've been awarding to help scale up our testing capacity, we've really focused on that turnaround time, and that's really drawn us to a lot of in-state labs like Jackson Labs, Yale, Genesis Diagnostics, and others where we are in-state. We have control over our own destiny here in the state of Connecticut, but most importantly, we know we can get that rapid 24-hour turnaround and get those positive cases into the contact tracing system as quickly as possible. So today, the vast majority of the testing that we've scaled up is in Connecticut.
First Connecticut Media.
Thanks, Max. Hi, Governor. Not to be presumptuous to put words in your mouth, but you were just saying we're going to adjust along the way. Isn't that really what you're trying to get across to people who want to know when the phase 2 openings are going to start, when the restaurants are going to be allowed to move some people indoors, and the whole phase 2 aspect here?
Yeah, Ken, I've thought about this sort of in monthly increments. And if May 20th we have a small partial reopening, for example, the outdoor restaurants you mentioned, over the next 2 to 3 weeks we'll have a chance to analyze what the effects have been, and that will give us some guidance for what people can expect on June 20th. And as I suggested before, you take that out right through the summer and think about what September of 2020 looks like and what we can think about in terms of schools and residence halls and the such. So, and maybe, maybe everything is not a straight line. Maybe there's some fallback. Maybe there's some flare-ups that come in from Boston or someplace, and we have to adjust along the way. That was part of the advice we gave our universities, by the way, Rick Levin's committee. They said, assume you'll be opening in September, but assume you have to change, but make sure you have a contingency if you have to change course in early August, because we may have to give you a change of notice. That's the world in which we live.
Thanks. Could I ask Dr. Koh a question, please?
Yes, please. Go ahead.
Could you give us an update, sir, on the childhood inflammatory syndrome? Maybe how many kids are afflicted now, what you're finding out about it over the last few days? We haven't had you in public talking about it for a while.
No, thank you for the question. And as you can imagine, we're all concerned about the reports. And actually, these reports first happened in England, where they've identified several clusters of kids with this inflammatory syndrome. This actually appears to have happened, is happening, weeks or days, if not weeks, after the kids have gotten COVID. It's probably, we don't know why it's happening, but what it's causing is this, systemic inflammation that's many times involving the heart, sometimes the gastrointestinal system. These kids have actually done well, but they've actually had, this very, undergone shock or, hypotension, low blood pressure with shock requiring, care in the intensive care units. Now what we're learning about is that this is actually happening here in the United States. Everyone has heard about the number of cases in New York. And just like New York, we're several weeks behind. So now we're starting to identify these cases among our kids. At this point, and I was just talking to my colleagues and friends at Yale New Haven Hospital, Dr. Rick Pierce, as well as Dr. Juan Salazar, who's the chief medical officer at Connecticut Children's Medical Center. They're seeing cases. They have right now 4 cases at Yale New Haven Hospital and 2 cases, and perhaps a third suspected cases in Hartford. So this is something that we're worrying about. This is concerned about, where we know that, we're going to learn a lot probably about why this happens, who it happens. I think what we know now, at least at this part, is that there's likely an association with the COVID virus. We have to stay vigilant on it. It still appears to be a relatively rare phenomenon, given what we expect of all the kids who have been exposed to COVID. But that's what we know at this moment. We will probably learn a lot more in the next coming days and weeks.
Hey, Albert, let me just add to that. I get a lot of feedback from people that say, look, just put the vulnerable population away. Put them, quarantine them, and let the other 75% of us go. Okay, we'll get infected, and then we'll have herd immunity, and everything will be fine. But Albert, what you reminded me is we know so little about COVID. We've got, and this is something we didn't even know about a few months ago. And this is a germ that could have long-term or medium-term impacts on people. This is what we're learning every day, which is why we have to be so cautious, I think.
No, that's exactly right, Governor. We are concerned about, when this whole outbreak, and just imagining this is a whole, a new pathogen first identified in the end of December, beginning of June. It's spread throughout the world. We have a pandemic, and every day something new is coming out about this virus and what it does. And I think we just have to learn from lessons in the past. We've seen countries, use the herd immunity or just let everything go approach, and then having to come back. And that was a cautionary tale that what happened in the United Kingdom. And that's also the cautionary tale for us here in Connecticut. We see other states that have opened up their economy very quickly, not the small grade, baby steps that we're taking. And we're concerned about our neighbors, and we're concerned about our fellow citizens in the United States. And so this is just underscores the caution that we need, and to put always the public safety first.
Thanks.
The Hartford Courant.
Yes, Governor. As you said, you have gotten some pushback on the reopening from both the left and the right. Today it was the Senate Democrats with some letters, and previously it was Republicans. Do you have any regrets that you didn't put any legislators on the advisory group for direct input? And why didn't you put any legislators on the group?
Because with our team, they were scientific professionals and obviously business folks who were actively frontline involved. But what was really important to me, Chris, was making sure, and poor Dr. Coe has had to do hours of this, we brief the legislators on a regular basis, back and forth, conversations, know exactly what we're thinking about, what we're doing, why we're doing it, augmented by what Paul Mounds has done as well. So we're doing everything we can to make sure that everything the reopening committee has been doing is totally transparent, especially when it came to the legislature.
Okay, also on the, if I can ask very quickly, so were you surprised today that one of the Senate Democratic letters had 25 questions? Is it your position that they had been briefed on that? There was literally 25 questions on the letter today.
Well, one of the things I'm finding is maybe you brief all the leaders, but that doesn't necessarily mean all the other members of the legislature get the information. Paul, do you want to step in on that?
Yeah, I'll be happy to step in. I think one of the things that was said in terms of the legislative involvement, I think myself, Andrew Newey, and Albert Coe will say that we've done many of calls with legislators on both sides of the aisle about the reopening. Many of their comments and their inputs from their caucuses led to modifications to many of the standards that have been put out. I could speak directly to Dr. Coe, who did about an hour and a half call just with Senator Fasano the other day based upon a request he has. I will say this overall, the legislature always has a role to play, and the executive branch has a role to play as well. And we've been working in collaboration in all aspects as it deals with this reopening, making sure that they're well up to date, making sure that their input is as part of the process. At the end of the day, the decision making on this is not just from the recommendations that come from the reopening committee. It comes directly from the governor, who takes in all this information and make these decisions. We've been working under that aspects. We'll be happy to answer any legislators' questions. We had commissioners, members of the administration, senior staff of the governor, as well as reopen committee, who have had hundreds of conversations with legislators and will continue to do so throughout this whole process. But one letter is not going to, or a few letters are not going to deter the progress that this whole reopening process has been making. But we will be happy to answer them directly.
Okay. Also, Governor, one last thing: the new CEO at the Partnership for Connecticut has been placed on unpaid leave, as you know. Did you know about that in advance? And do you think she should be replaced?
I was informed about that, just a few days ago, and let me get all the facts in place. I think there's going to be a special meeting of the board, and I can report back to you.
The Waterbury Republican American.
Thanks. Start off with a couple of reader questions that I think should be fairly simple to answer. If fitting rooms are going to be closed, what about footwear? How will customers be able to try on shoes and sneakers and boots?
All right, who wants that one? The silence is deafening. I'll tell you what we have done, though, because I don't have an easy answer for you on this. We have met with a number of the folks that run the leading clothing stores to get their very best input on how we can do this on a safe basis. As Dr. Koh can tell you, the germ can stay in a shoe or in a piece of clothing for a few days. I can't tell you exactly how they've resolved trying on shoes, but I know they've come up with a solution.
Thank you.
Thanks, guys. You were no help at all.
Thank you, Governor. I can add one thing. Those are the questions that keep us up all night and day, and that's actually a question which we have as I think one of the really good outcomes of the Reopen Connecticut Advisory Board, but also working with the state, is that we have people from the state OSHA, working together with leading academics, leading experts in the occupational health, and really going through all those nitty-gritty types of questions. And a lot of them have already been placed for a lot of the businesses on the website, the Connecticut.gov coronavirus website. But those questions exactly about how to deal with shoes, and those are the things that are keeping us up all night, and that's work in progress. So you'll find those guidelines coming up pretty soon.
Yeah, and I guess I'll jump in and add that David Lehman, the member of the team of OSHA, as well as Dr. Koh and his team, have been working directly with the retailers on these kind of very specific questions. This is the perfect example of how this Reopen Committee is working. So much so that we got a question from House Democratic Caucus about consignment shops and individuals trying on clothes in consignment shops and how that process is working, and provided input and information that helped further inform the overall process. So I think as you go into these very, very specific questions, that's when you get to see the secret sauce that is how this Reopen Committee has been working to make sure we're putting out guidelines that is not only informing the retailers, informing the public, but also making sure that they're comfortable with the reopen potentially on May 20th.
Okay, state law lets retailers set their own refund policies and exchange policies as long as they're conspicuously posted so customers can read it. But we're getting a question, if you can't try on clothes in stores, can you return them if you try them on at home?
Let us get back to you on that.
Okay, well, this one I think you might be able to answer then, Governor. Currently, Bradley Airport, International Airport, is not screening for COVID-19 because apparently it's not required by CDC guidelines. Why isn't the state of Connecticut requiring any kind of COVID-19 screening at Bradley International Airport?
My understanding is, and Josh, correct me, I think 95% of the passenger traffic at a Bradley Airport is virtually ground to a halt. It's almost all, package delivery at this point. But to your bigger point, you're right. COVID came to the Northeast, not necessarily from Wuhan, but came through Europe, and right to JFK and right to a Newark International Airport. That was the COVID highway. And there, the testing would have been really advantageous early on.
Okay, and final question. I guess this one would be for Dr. Koh, and I'm sure Josh, if he wants to hold forth, and as well as yourself, Governor. The letter from, or one of the letters from the Senate Democrats said that the guidelines set by your reopen advisory group indicate 42,000 tests per week are required to begin reopening, but 140 tests per week are needed to prevent new outbreaks. When will either of these targets be met, and can you assure sufficient testing materials can be sourced to maintain these testing levels?
Good. Thank you. Let me answer that first, and Josh, if you want to add to that. So let's just think about why testing is important. And testing serves multiple purposes. The presentation by the governor today is just one. But the other that's important is that testing allows us to detect outbreaks or detect increases in transmission. And so 42,000 tests allows us to broadly cover all the people who have symptoms and who are able to, potentially pass the disease on to others. But it also gives us an opportunity to do surveillance, right? And to identify, rather than having to wait until somebody comes to the hospital, identify them early in the course of illness. And so we get to get a better handle about whether we have an increase, of transmission in the communities. So that's the importance of testing. And that 42,000 gives us that which the state is going to reach in the next several days, gives us that opportunity. To do all the other part, we're going to have to do more than just testing those 42,000 people who have symptoms. And we have to go beyond. And that's where we're going to try to do as we're opening up in these small steps, the economy, to prevent the transmission by screening people, whether it's not only the people in the nursing homes or in our correctional facilities, but also in our high-risk communities. And that's what's our goal in the next 6 weeks as we go up to the end of June.
Yeah, and I'll just add, so specific to where we are today, against the goal of 42,000 tests a week for May 20th, with those agreements that we mentioned in the charts with those various labs in Connecticut, we now have locked in capacity for over 70,000 tests per week by May 20th. In terms of the question about the supplies, the governor's been on the phone with the chief executives of the key suppliers that those labs count on for their supplies, and has received personal assurances that the supplies will be in place when we need them. And then we're on our track from there to keep going. And as the governor said before, we expect to be over 100,000 tests a week and beyond into the month of June.
All right, everybody. Max is giving me the signal. Dr. Koh, again, thank you so much. I hope you're not up all night long thinking about the trying on the shoe issue. You may be here outside. There's a horn honking protest, something that happens more frequently. I have no idea whether they think we're reopening too quickly or too slowly. I like to think that means maybe we're getting this balance right. And Dr. Koh just reminded me, talking about the childhood effects from the COVID, to misquote Donald Rumsfeld, we know what we know, but what just importantly is to know what you don't know. That's why what we're doing, we're proceeding very cautiously, one step at a time. Thank you, everybody.